Hey guys, I wanted to talk to you today a little bit about the controversy that people are having with the new percussion vibration therapy tools such as Theragun, Hypervolt, things like that. So there's a lot of people that are in love with them and a lot of people that swear up and down that there's no way that that could have any possible benefit to it. So I want to kind of give you guys some scientifical things on what vibration therapy does for the body and why it can do things that other instruments can't do. So I have the Theragun G3, the Pro. So it has, movable things on it. It does a bunch of different things. It makes it kind of nice and ergonomical so I can get everywhere kind of on myself. I like using it quite a bit. I don't use it as I got to get this muscle loose, this is what I'm going to use it for. I use it for a completely different purpose. What it does specifically, so there you have a thing called extracellular matrix, and it's kind of like this jelly substance that's in between tissues and muscles and things like that. So when this tissue or this extracellular matrix is kind of ignored, what happens is it kind of gets more like jello, if you can think of it like that, and it doesn't become that hard, but for this example that's what we'll say. So it's kind of like jello per se. On the outside of this extracellular matrix you have a receptor site called an integrin, and that integrin can only be stimulated by stretching or by vibration. So unless you're getting stretched out or you're using like a vibration therapy or a vibe plate or something similar to that, then you're not actually getting this receptor site to activate and relax and make this extracellular matrix more like a fluidy substance. So then that way there's better gliding layers, there's better gliding between the layers, and that there's not as much friction going on. So if it's more of that jello substance, like I said earlier, you're going to get more of the slower acting, maybe tougher time to do it. When you use the vibration therapy, that integrin gets activated, and then it creates better fluidity between the layers. So I always use it after I do like my myofascial work. If I need to get into some deep tissue therapy, I try to make sure that I always use the Theragun at the end of it. Why? Because I can get the fascia to release and I get the deep muscle to kind of release and relax, but I can't actually get to the extracellular matrix. I can't affect that at all with my hands. So this vibration therapy tool literally makes that possible, to where I can take my therapy one step further. And there's a lot of people out there that are saying, what is this going to do? Just pounding the tissue. How is that even going to help? And really, this is not made to be pressed and dug into the body. It's actually made to glide across the top layer. What it's supposed to do is it's hitting at such a rapid rate that the body's receptor sites and the body's signaling up and back and forth through the brain can't correlate quick enough of what's going on because it's hitting so quick. By doing that, it's allowing the muscles and the tissues and things like that to relax, and it's allowing them to be kind of confused, if you want to think of it in that sense. So it's hitting, and you shouldn't dig. So that's the big thing that Theragun preaches, is it's not a tool to dig in and really beat up the muscle. That actually is not going to really do too much. Could actually, irritate trigger points. It could make nerves irritated, things like that. So it's made to actually just graze the very top layer of the skin, and that is what actually helps the tissues and the muscles kind of relax and become more, circulated with blood and things like that, become more oxygenated with the blood flow. So you have to know how to use it properly, where to use it at, and not, digging into people and things like that. So it's very important that you know how to use a vibration therapy tool. But I think there's a lot of controversy between people saying that it does absolutely nothing and they're just a waste of money, as opposed to what they actually do from a scientific level. So if you're contemplating, should I get a Theragun, should I get a Hypervolt, whatever it may be, depending on how you're wanting to use it, it might be the right tool for you. If you're wanting to dig into yourself to beat the heck out of your muscle, you can do it, but it's not going to be very beneficial. But if you're wanting to use it to actually, warm up the tissue before you work out, cool it down after you're done doing your workout. If you're a therapist or a chiropractor or a physical therapist or anybody in the profession, then using it to help the soft tissue and get blood circulation and things like that, it's actually very helpful. And from a scientific level, it actually does have evidence based that this vibration is actually doing something for the tissue. It's not just wasting my time and just using it as a time filler. I always use it, like I said, at the very end of the session. I get everything released and relaxed. I get into the muscles if I need to get deeper into the muscles, and I always go over that at the very end. So that way I know I'm getting that extracellular matrix. I'm getting that one little extra step that's going to kind of help my treatment stand out from somebody else's. Whereas if you do just a manual therapy and you get done, you might not have as good a results if you go over it, at the end with the Theragun. And I'm not using it just because it feels good. It does feel good, but I use it for a greater purpose, for those extracellular matrix. So I wanted to just kind of tune in with you guys today, talk to you a little bit about why I think it's important to use the tool, and kind of let you guys know some scientific facts behind it, because I know that there's a lot of skepticism between whether or not it's actually useful, and it's a pretty expensive tool. But if you're in the profession, or even you're a high-level athlete, it's a very important thing to actually use to keep the tissues and everything as healthy as possible. So if you guys want to ask me any questions, and I would be happy to try to get back with you with the best answer I know how. But I recommend the Theragun. I think it's really great, super durable. I've dropped it off of my top shelf in my bookcase and things like that. Still works, still kicking. I've had a hypervolt before. I've actually know a professional athlete that dropped his from like 2 feet up high, and we turned it back on and it was smoking out of it. So that's good for like a clinical setting if you're trying to be really quiet. I mean, this gun's, it's a little loud, but it's actually quieter than the other models that they've made. But I like it better. It's more durable. I can throw it in my book bag and run around with it and go do mobile appointments, and I can let my child drop it. And not that I'm trying to let them, but you can let your child drop it, or I can accidentally drop it, and it's very durable and it holds up pretty well. So that's what I would recommend. And again, if you guys have any questions, I'd be happy to answer. But that is my little talk today about vibration therapy and why I think it's important to incorporate in your treatments. So take care, guys, and I will be back to talk to you guys soon.